My name is Gift Chinyelo. My presentation is in fulfillment of the required coursework at ECPI University. The course is Nursing 444L Community Health Lab. I'm going to be organizing a health fair based on a community need, church and public work. Goal statement: impart knowledge to audience primarily made up of African American on and how hypertension disproportionately affects African Americans and the danger of poor management of the disease. Introduction: teach the target audience what hypertension and diabetes are and how to recognize their onset stroke symptoms of diabetes and hypertension. What is high blood pressure? High blood pressure is the pressure that blood flows expert on arteries wall. High blood pressure indicates that pressure against artery walls is too high to cause damage. It is also called hypertension. What is diabetes? Diabetes is a risk of sugar level above normal in the body. Diabetes indicates that the body can no longer produce insulin that controls sugar in the body or does not respond to insulin production. Causes of high blood pressure: it can be biological, disposition, preposition, medication, underlying medical issue, lifestyle. I'll treat on biological preposition. Congestive heart defects, which are also referred to as blood vessel problem, present at birth. Medication: cough and cold medicines, some pain reliever, pain control, and other prescribed drugs. Illegal drugs use, such as cocaine. Underlying medical issue: some people have secondary high blood pressure which result from underlying condition. This type of hypertension tends to appear suddenly. Example of it is like kidney disease, obstructive sleep apnea, thyroid problem, and alcohol consumption. Lifestyle: smoking induces increase in blood pressure and heart rate. Eating too much salt, eating fatty food helps increase susceptibility of high blood pressure. Consuming high level of caffeine such as coffee, soda, and energy drink. There are causes of diabetics. Some of the causes of diabetes: race is a serious factor in development of diabetes. Blacks, Hispanics, and African India are at higher risk. Biological preposition: it may run in the family. Poor and unhealthy diet can lead to diabetes. How to recognize hypertension onset and symptoms of high blood pressure. Hypertension: blood pressure is regarded high if exceed 120/80 mmHg. Symptoms include repeated recurrent headache could be sign of high blood pressure, having problem with your vision, having swelling on ankles. What to do: contact your physician immediately. Do not wait for symptoms to disappear. Onset of diabetes: normal level is 99 mg/dl or lower. Pre-hypertensive can be 100 to 125 mg/dl. Diabetes 126 mg/dl or higher. Symptoms include frequent urination, feeling of weakness, blurred vision, sore that heals slowly, weight loss without effects. What do you do? Contact your physician immediately. Upon notice, maintain strictly medical follow-up. Sugar level returns to normal. Effect of high blood pressure: over the time, Pledge build up in the arteries, making the inside of the arteries smaller, causing high blood pressure. Anyone with such plaques build up is danger of hypertension, known as essential hypertension. It weakens the immune system, making the individual susceptibility to disease. It reduced blood flow can lead to electric dysfunction, erectic dysfunction, negatively affecting your sexual performance. It can lead to heart attack or stroke. It can cause purge in the arteries walls and rupture and bleeding. It can cause damage to the heart due to um, limited supply of blood flow. Limited supply of blood flow. It can cause the heart to fail due to heart being overworked. It can cause liver damage. It can lead to death if untreated. Effect of diabetes. Diabetes increases the risk of heart attack and stroke. It can cause serious damage to the liver, causing loss of liver function. It can cause blindness. It can cause hearing problem. It can cause lack of blood flow to the lower extremity. It can also cause the likelihood of developing dementia. It can lead to death if untreated. Who is at risk of hypertension, of high blood pressure? Those races play a role. The short answer is yes. African Americans are at greatest risk for high blood pressure than Caucasians. African American higher rates of stroke, end-stage renal disease, and congestive heart failure. Caucasian have 23.8% risk of hypertension and 30 years mortality rate. African American have 45.2%. This is significantly high. It is documented that African American demonstrate poorly high blood pressure control than Caucasian. Action against high blood pressure. Monitoring. Monitor your blood pressure. Check it daily to know the status. Avoid taking anything that contains caffeine before checking your blood pressure. Diet. Eat low-fat diet, plenty fresh vegetable and fresh fruit. Avoid canned foods because many of them contains a lot of sodium. Significantly increase the intake of sodium. Avoid skin of meat. They have high amounts of fat. Eat more fish and eggs. These are proteins, more of proteins. Avoid alcohol of any type. Exercise. Carry out 30 minutes of exercise daily. 30 minutes of aerobic exercise daily, which can include walking, jogging. Make effort to maintain muscle strength, e.g. weightlifting. Take steps to stop smoking. Action against disease. Monitoring. Self-monitoring is very important. You can use a device known as continuous glucose monitoring. You can also test your blood sugar at home with an electronic device known as a blood sugar meter using a small drop of your blood. Diet. As in hypertension above, healthy eating is highly advised. Exercise. As in hypertension, 30 minutes of exercise daily can be very helpful. Make effort through exercise to maintain muscle strength. Make efforts to lose weight. Take steps to stop smoking. The smoking connection. Smoking severely increases your blood pressure and heart rate. Smoking helps build up plaques in the arteries. Plaques in the arteries can lead to heart attack and stroke. Smoking cessation step. Prescription. Narcotic in a nasal spray or inhaler. Narcotic patch, gum can help without prescription. Prescription, non-nicotine, stop smoking. Drugs such as Wellington, they will help you with the urge of smoking. In conclusion, Hypertension and diabetes are interval. Blacks are in higher risk of hypertension and diabetes than Caucasian. Smoking has to the risk of developing high blood pressure and diabetes. Efforts can be taken to quit smoking. Hypertension, high blood pressure, and diabetes, if left untreated, can lead to many diseases, including death. Effort can be made to control the disease. My reference is, in conclusion, if high blood pressure and diabetes is untreated, it can lead to death. Thank you.